day everyone, we are the reporters for today and we will be discussing another important topic. So today's topic will be malignant melanoma. But before anything else, allow us first to introduce ourselves to you. I am Shariza as Recamara.
Hi, I am Catherine A. Aripal and I am one of your reporters for today.
I'm Aryan May Indus.
So we will be starting this report with a quote from Dr. Georgiana Donadio. She said, and I quote, "Your skin is the fingerprint of what is going on inside your body and all skin conditions." Close quote. So here is the topic outline of our report. We will be discussing what is malignant melanoma, the pathophysiology, etiology, risk factors, signs and symptoms, complications, medical treatments, nursing diagnosis, and nursing interventions of this disease. Okay, so let us first know what is malignant melanoma. Malignant melanoma is a common skin cancer that arises from the melanin cells within the upper layer of the skin, which is called the epidermis, or from similar cells that may be found in moles. This type of skin cancer may send down roots into deeper layers of the skin, and some of these microscopic roots may spread or metastasize, causing new tumor growths in vital organs of the body. So we all know that our skin has melanocytes. So these are cells in the skin and even in our eyes that produces and contains the pigment called melanin. So we all know that the melanin is the substance in our body that produces hair, eye, and skin pigmentation. So the more nga mag-produce og melanin ang atong body, the darker our eyes, hair, and skin will be. So these melanocytes are located in the layer of basal cells at the deepest part of the epidermis. So a melanoma is a tumor produced by the malignant transformation of melanocytes. Melanocytes are derived from the neural crest. Consequently, melanomas, although they usually occur on the skin, can arise in other locations where neural crest cells migrate, such as the gastrointestinal tract and brain. The 5-year relative survival rate for patients with stage 0 melanoma is 97% compared with about 10% for those with stage 4 disease. So kaning melanocytes, mag-send down ni siya roots sa deepest layer in our skin, and the roots may spread or metastasize, causing new tumor growths affecting the vital organs of our body. Malignant melanoma accounting for about 3 to 4% of all diagnosed skin cancers. So the incidence is rising by 3% a year, and higher incidence amongst whites. So mas common ni siya sa mga white-skinned population. Highest per capita incidence amongst Australians, and median age for diagnosis is 58 years. Okay, so now we will be discussing the pathophysiology of malignant melanoma. So it all starts with the melanocytes. So melanoma begins when healthy melanocytes change and grow out of control, forming a cancerous tumor. Malignant melanoma, malignant means cancerous. So a cancerous tumor is malignant, and it means that it can grow and spread to other parts of the body. Okay, so after atong abnormal change and growth of melanocytes, it can cause melanocytic atypia. So these are irregular moles and skin spots that requires further examination. Okay, so after aning melanocytic atypia, there will be an hyperplasia. So hyperplasia meaning there is an increase in the number of cells in an organ or tissue. So this means that when there is an atypical melanocytic hyperplasia, it consists in an increased number of melanocytes along the epidermal basal layer. So melanomas have two growth phases, namely radial and the vertical growth phase. So during the radial growth phase, malignant cells grow in a radial fashion in the epidermis. And moadto din siya sa vertical growth phase. With time, most melanomas progress to the vertical growth phase. in which the malignant cells invade the dermis and develop the ability to metastasize or to spread. Then, manaog na dayon siya sa metastatic melanoma. So, it is the spread of primary melanoma cell, distant organs such as lymph nodes, lungs, liver, brain, and bones. So, diri na dayon tong ma-metastasize na siya, the ability to metastasize or to spread in other organs or other parts of our body. So, there are 4 types of melanoma. So, the first type is the superficial spreading, malignant melanoma. The second type is the nodular melanoma. The third type is latingo-maligna melanoma. And the fourth type is the acral melanoma. So, we will be discussing each types of this malignant melanoma. So, the first type is the superficial spreading. So, the most common type of malignant melanoma in the white skin population. So, there are 70% of cases, and the commonest sites are the lower leg in females and back in males. So, in early stages may be small, then growth becomes irregular. So, there are pictures in the PowerPoint showing the superficial spreading melanoma or the first type of melanoma. Okay, so the second type of malignant melanoma is the nodular melanoma. Kani siya nga type is most common sa mga males. And the common site of this is the trunk. It rapidly grows, usually thick with a poor prognosis, and black and brown ang iyang nodule. Ulceration and bleeding are common in this type. So, there are pictures mo na siya mo itsura sa nodular melanoma. Okay, so the third type of malignant melanoma is the lentigo-maligna melanoma. It occurs as a late development in a lentigo maligna, mainly on the face in elderly patients. So, mas common ni siya sa mga tigulang. Maybe many years before an invasive nodule develops. So, mao na siya may itsura sa lentigo-maligna melanoma. Okay, so the last type is the acral lentiginous melanoma. So, in white skin population, this accounts for 10% of malignant melanomas only. But, it is the commonest malignant melanoma in non-white skinned nations. So, atong mga non-white skinned population or mga people, this is the most common malignant melanoma. So, it is found on palms and soles, sa mga palad and sa mga lapalapa. And then usually comprises a flat lentiginous area with an invasive nodular component. So, mao na siya mo itsura sa acral lentiginous melanoma. Okay, so let us proceed to the etiology or the cause of this skin cancer. So, malignant melanoma is idiopathic, which means the cause is unknown. But there are several factors relating to the cause of this skin cancer. So, one of this is the excessive exposure to sunlight. So, too much UV radiation from the sun or sunbeds can damage the DNA in our skin cells. So, we all know that DNA tells our cells how to function. So, if madamage ang atong DNA over time, it can cause cells to start growing out of control, which can lead to skin cancer. Next is genetic predisposition. So, people who carry a mutation on a gene known as CDKN2A have a higher risk of developing melanoma. So, unsa maning CDKN2A gene? So, this gene provides instructions for making several proteins. So, the most well-studied are the P16 and the P14 proteins. So, kani siya both functions as tumor suppressors, which means they keep cells from growing and dividing too rapidly or in an uncontrolled way. Okay, so one related factor is also the personal characteristics, and then atypical mole syndrome, formerly termed as BK mole syndrome or dysplastic nevus syndrome, or familial atypical multiple mole melanoma. And lastly is the socio-economic status. So, lower socioeconomic status may be linked to a more advanced disease at the time of detection. Okay, so at this point, Ms. Aripal will be discussing the risk factors, signs and symptoms, and the complications of malignant melanoma.
Good day, I am Catherine A. Aripal and I will be discussing to you the risk factors, the clinical manifestations, as well as the complications of a malignant melanoma. Malignant melanoma is caused by a combination of a genetic as well as an environmental factor. So now I'm going to discuss to you the different risk factors affecting melanoma. And the following are the risk factors of malignant melanoma. So first we have here exposure to sunlight, severe sunburn, and sunlight sensitivity or sun sensitivity. So this is due to excessive exposures to UV radiation or sunlight may lead to damage to our DNA in our skin cells or in our melanocytes. And these melanocytes are the ones who produce melanin, which serves as a protective layer to our skin to protect us from the sunlight or UV rays and to avoid skin cancers or skin diseases from developing. And if this damage to our skin cells remains untreated or is left unrepaired in our body, this may then result to the development of abnormal cells and may lead to development of skin cancers or skin melanoma. Aside from sunlight-related risk factors, we also have family history of melanoma. So, melanoma can run into families and can be called a familial melanoma, which can run from generation to generation. And it is said that 8% to 10% of individuals or clients with melanoma have first-degree relatives or family members with the same skin cancer or skin condition. And there could be genetic mutations or genetic factors influencing this occurrence. So there could be genetic alterations or mutations, and some of them is the CDKN2A and CDK4 genetic mutation. So familial melanoma follows a autosomal dominant inheritance pattern wherein only one copy of a gene is genetically mutated or affected. But aside from that, there are also environmental factors relating to the occurrence of melanoma in families. This could be related to their lifestyle because usually the lifestyle of family members are similar to one another. It could be how frequent they are exposed to direct sunlight. It could be also due to their skin color because usually family members have the same kind of skin color or skin texture or characteristics. Next is geographic location. So individuals who live in countries or places near the equator or tropical countries like the Philippines are at higher risk of having melanoma or malignant melanoma. Why? Because these countries experience long periods of bright sunlight and are more exposed to higher degrees of ultraviolet radiation. And being said that sunlight is one of the factors or the predisposing factors on why an individual can have a malignant melanoma or skin cancer. And then immunosuppression. So immunologically suppressed individuals as well as immunosuppressive drugs, bacteria, diseases, and viruses play a huge role on why an individual can have a skin cancer or malignant melanoma. So our immune system is the one who fights foreign bodies that may inflict disease or conditions or abnormalities to our body. So if our immune system is weak, therefore it cannot repel, detect, as well as destroy and fight cancer cells that are forming in our skin. And therefore, these cancer cells or abnormal cells multiply or double in number and form malignant tumors that, when left untreated or unrepaired for a period of time, may then lead to the formation or development of skin cancer. And aside from the aforementioned risk factors, we also have being fair-skinned as a factor affecting or influencing the occurrence of melanoma in a person. So, fair-skinned individuals are prone or at risk for melanoma because they have lesser melanin production in their bodies, and this melanin is supposed to be a protective layer on their skin. So because they have lesser melanin, therefore when they are exposed to the sun, they are most probably more affected than other individuals who have darker skin. But remember, darker skinned individuals can also have melanoma due to other factors as well. And then being blue-eyed or green-eyed, as well as having blonde or red hair. So why is this considered so as a factor? Because individuals who have blue eyes or green eyes, blonde or red hair, share a common gene in their bodies or in their DNA, in which produces a trait or appearance of having a lot of freckles in their skin and having a lot of moles. So why are moles and freckles considered as an associate for this risk factor? Because aside from all those other risk factors, having large moles or patches, because the presence of moles and freckles in our body, like dysplastic moles, which are flat, asymmetrical, irregular, and variably pigmented moles, can be associated for melanoma, because this description of a mole is associated to a cancerous mole. It is not a normal mole that you can see in your body based on the ABCDE assessment, which I am going to discuss later on. And these dysplastic moles are usually a result of excessive or extreme sunlight exposure. So it is really related to the factors affecting in combination with having a malignant melanoma. And this mentioned benign nevis are closely relevant in terms of risk factors affecting melanoma, because they can be simulators. They can be trigger points for occurrences of melanoma, because they can be a site for formation. They can be a site for development and emergence of melanoma or skin cancer, because they are already moles, and melanoma can emerge as a mole. It can disguise itself as a mole. So sometimes it's hard to detect melanoma, but sometimes with a proper assessment and early detection, melanoma can be prevented or can be cured right away to prevent it from proliferating to the other parts of our body. And now let's move on to the clinical manifestations or signs and symptoms of a malignant melanoma or a skin cancer. So usually a melanoma is brown or black in color, but oftentimes it can also be color red, violet, or any color depending on its characteristic and its type. But the signs and symptoms that I'm going to be mentioning to you right now is more focused on the characteristic of the moles that we see in our skin for us to differentiate what is normal from abnormal. So melanoma is a certain type of condition that might be easy for you as a person to detect in your body. As long as you know and know how to differentiate what normal moles is from abnormal moles. It can be through the ABCDE assessment, which I'm going to be teaching you later on. So through a vision test or through an inspection, you may notice and then detect melanoma if ever you have melanoma in your body. So it could be basing on the color, on the shape, on the size, on the other characteristics of the moles that are already existing in your body. And therefore, here are the signs and symptoms that may help you to identify what is melanoma and if ever you already have melanoma in your body. So first, we have here irritation, feeling of tenderness and pain, as well as bleeding on a sore that does not heal. And then we have swelling, redness, and pigmentation going outside from a border of a certain spot, which then spreads out towards the rest of the surrounding tissues. Changes in the texture of your moles or the scales, or if there are oozing or bleeding on your existing moles in your skin. And then changes in your vision, if ever you have blurred vision or a partial loss of sight, that may also indicate melanoma. And then feeling of limbs or lumps under your skin. If you feel something that is something that is hard under your skin, that can also be an indication. And now that I have already mentioned to you some of the clinical manifestations of a malignant melanoma, allow me to introduce to you a method or a assessment that you can perform even by yourself or at home to help detect melanoma early on in its stages or phase, to help prevent proliferation and spreading of the cancer or the skin cancer to other parts of your body, to help avoid complications which may lead to death. So we have the ABCDE method, which may help alert us if there is a abnormal skin growth in our body or a forebudding skin cancer. So ABCDE is asymmetry, border, color, diameter, and then evolving. For asymmetry, a normal mole should be consistent in its appearance, its size, and its shape. So if you have a mole, and if one side is not identical to the other side, then it is considered abnormal. And then for the border, a abnormal mole or a melanoma, its border outline is poorly defined, so it's kind of diminished or fading the outline of the mole. And then for color, usually a melanoma is of color brown or black, but sometimes there is inconsistency in the color. Some parts will have a color of white, blue, or some parts may be fading and some parts is dark. And for diameter, a abnormal mole or melanoma is larger than 6 millimeters of a ruler. So a normal mole should not go beyond 6 millimeters. And for E, evolving, if you notice that a mole in your body, every time you inspect it, so if you notice that a mole in your body, which was a few years ago or a year back was small, and then recently when you inspect that mole, if you notice that it has become bigger or larger in size, then it is viable for melanoma, because it is no longer normal, because a normal mole shouldn't evolve. If it's small, then it should stay small, but if it evolves into a bigger size, then it is already abnormal and it may become a risk factor for acquiring or for the occurrence of malignant melanoma or skin cancer in your body. In light with what I have mentioned to you about the ABCDE method, as well as with doing assessments, it is always best and beneficial for our own good for us to be self-aware, to be aware with everything that is happening in our body, because it is best that if you notice anything unusual or any mark on your body that you are not sure of, or any mark, you can always do the ABCD assessment, and for a better findings, and for you to be more confident and at ease, you may also consult or have it checked in a clinic or a derma. And now, on a more severe degree of having malignant melanoma, wherein your melanoma or your skin cancer have already proliferated or spread out to different parts of your body and have invaded organ systems and organs, you may clinically manifest or experience the following symptoms and signs, such as a swollen or painful lymph nodes or a hardened lump under your skin, headaches and seizures, a sense or a loss of appetite, and unexplained weight loss, then bone fractures or bone pain, difficulty in breathing, and dry cough, as well as enlarged liver. So those symptoms and signs are a much more life-threatening, because your skin cancer have already affected different organs in your body. Therefore, the manifestation is not only centered or focused on your skin, it has already reached other organs. Therefore, it is worsening. So it is really important that you are able, if you have melanoma, that you are able to prevent proliferation and spreading of this skin cancer and having infections in your body, for you to be able to recover fast, and then to avoid any other complications, which I am now going to mention to you, the complications that may occur in malignant melanoma. And here you have the complications of a malignant melanoma. So these conditions or these occurrences happen when the skin cancer is already at an advanced stage. So here they are. And first, we have the secondary infection, which is an infection that occurs after the malignant melanoma has already transpired. And then this is a result of the disruption or the destruction of the normal skin barrier. And then we have scarring, which is a result of the lesions, the wounds, due to the bleeding and oozing of substances in the moles. And it may also be due to the treatments that the patient undergoes for the condition. And then we have lymphedema, which is secondary or occurs right after the removal of the lymph nodes, which are one of the risk factors or the manifestations of the condition. And this lymphedema is a complication because it is capable of evolving into a cancer on its own. And furthermore, we have the local recurrence and invasion. So this happens when the skin cancer have already worsened and is at an advanced stage. So this may happen if the skin cancer was detected late, and even if the treatments and measures have already been performed, it may reoccur again if it have already embedded towards your integumentary system, into your body, if it has already complicated. And then next, we have the regional and systemic metastasis. So what is metastasis? It is when a cancer have already proliferated and spread out towards the different parts of your body and organs. It may reach your brain, your bones, your integumentary system, and your gastrointestinal system. So if you have remembered the signs and symptoms that I have mentioned earlier, when your skin cancer or malignant melanoma have already complicated and worsened, such as nausea and vomiting, bone fractures and bone pain, headaches and seizures, those are the signs and symptoms or manifestations that you may experience when there is already a regional and systemic metastasis in your body due to malignant melanoma if it is left untreated. And then lastly, we have depression and anxiety. So how or why will a person with skin cancer experience depression and anxiety? Usually it is due to cosmesis issues or issues in terms of repairing the client's health, appearance, beauty, and other aspects of their well-being. So because with regards to the moles, bleeding, lesions that is part of the skin cancer, or that is a manifestation of the skin cancer, it is not surprising that the skin integrity and appearance of the patient will be altered and damaged. So it is not surprising at all that the client will feel depressed and anxious with her appearance and well-being.
I'm Aryan May Indus, and now I'm going to discuss the management and treatment, nursing diagnosis, and intervention of malignant melanoma. So for management and treatment, we have surgery, chemotherapy, radiation, immunotherapy, and targeted therapy. So for surgery is used to diagnose and treat melanoma. A biopsy, removing a tissue sample to examine, is done to make the diagnosis. The doctor may need to see if the melanoma has spread to the lymph nodes, which are small structures that help the body filter out harmful substances. So a biopsy of the lymph nodes is called a sentinel node biopsy. So if the tissue is found to be melanoma, the entire mole or affected area is removed. Next is the chemotherapy. So chemotherapy uses powerful medicines to kill cancer cells or stop them from growing, dividing, and making more cancer cells. So chemo is usually used if the disease has spread to the lymph nodes or to other organs of the body. Chemo may be injected into the bloodstreams so that it can travel throughout the body. So some chemo may be given by mouth, combination therapy that uses more than one type of chemo at a time. Next is the radiation. So radiation uses high energy radiation to kill cancer cells. Radiation therapy is another treatment option if melanoma has spread. Next is the immunotherapy. Immunotherapy activates the immune system and destroys the melanoma cells. So, children 12 years or older with melanoma that cannot be removed by surgery or whose cancer has spread to other parts of the body are sometimes given an immunotherapy called Yervoy. So, other immunotherapies can also be given directly into the tumor. So last is the targeted therapy. So targeted therapy uses medicines to attack a specific mutation or change in the tumor. For example, medicines called BRAF and MEK inhibitors target cells with mutations in the BRAF gene. So this mutation found in about half of all melanomas. Nursing diagnosis includes risk for infection and risk for advanced inactivity. So for nursing interventions are monitor temperature, Temperature elevation may occur if not masked by corticosteroids or anti-inflammatory drugs because of the various factors such as chemotherapy, side effects, disease process, or infection. Next is to assess skin for signs and symptoms of infection on a continual basis. So, early recognition and intervention may prevent progression to a more serious situation. Next is to bath with lukewarm water and mild soap. It maintains cleanliness without irritating the skin. Next is to encourage the patient to avoid vigorous rubbing and scratching and to pat the skin dry instead of rubbing. So it helps prevent skin friction and trauma to sensitive tissues. Next is to review skincare protocol for patients receiving radiation therapy. Avoid rubbing or the use of soap, lotions, creams, ointments, or powder on the area. So designed to minimize trauma to dry area of radiation therapy. So it can also potentiate or otherwise interfere with radiation delivery. May actually increase irritation and reaction. So skin is very sensitive during and after treatment, and the irritation should be avoided to prevent dermal injury. Next is to avoid applying heat. Helps control dampness or pruritus. So next is to recommend wearing soft, loose cotton clothing. So it protects skin from ultraviolet rays and reduces the risk for recall reactions. Last is to encourage liberal use of sunscreen or black and breathable protective clothing. So, development of irritation indicates the need for alteration of rate or dilution of chemotherapy and change of IV site to prevent a more serious reaction. So, that are the nursing intervention of malignant melanoma.
And that concludes our report. We hope that you have learned something new and have gained insights about skin cancers, skin diseases, and malignant melanoma in general to help you as a nurse in your future endeavors, your families, as well as your future clients in navigating throughout this disease or condition. Thank you and have a good day. God bless.